that fits onto the ridge, just relax your jaw and just relax your lip. We just pull the lip up, just deadpan drop it onto that. Don't pull it, just let it drop. And it looks like we got a 6. That lower lip line dead relaxed. We want that measurement in 6 millimeters. Right there. Okay, again, this thing fits right onto the bar. Deadpan drop the lip. It looks like a 6, 5.5 to 6. Then, to give us an idea what size teeth to use, we have an meter. You can just relax. We're measuring the alas of the nose. And that measurement actually falls dead center in the cuspids. When you bring it down, that's a dead center in the cuspids. And then when we do our reading, where it points, we know that this patient is going to have relatively wide teeth. And there's a large selection of teeth that fall into this area. The Aesthetic Control Base, or ECB, is used to transfer necessary information from the patient's mouth to the laboratory. It is made from modern material SureWax. There is no room for an acrylic base plate. The bar leaves little room for a base plate without severely modifying the denture teeth. One piece of wax is folded over in half and contoured to the arch. The second sheet of wax is folded in thirds and is formed around the first sheet of wax and forms the arch form. Okay, now we're going to make the aesthetic control base, and the wax that we use is modern material SureWax, and this material is very nice to work with. It's stable. When we get the teeth set up on it, it's very easy to move the teeth around. It doesn't flake or disintegrate when you warm it up to move teeth around. And I've been using this wax for many years. We're going to warm it up. The first step in the aesthetic control base is to warm up the wax, and then you fold it in half. So you get this material. See how it doesn't flake when you warm it up? It just stays nice and pliable, and it adheres to itself. And what we're going to do is stretch it a little bit here, and then put it over the palette and just place it down and mold it to the stone as you go around. This can be used for full dentures as well, this technique. This was developed for full dentures, and I've modified it. This technique, it's the old Swissadent technique for overdentures. Then we take a waxing instrument, this wooden handled waxing instrument, and then just cut through the mucobuccal fold all the way around. And we're going to leave the palette in for the try-in just so we have enough wax to have a solid base for try-in. Okay, that's the first wax that we apply to this model, and then the second wax sheet we're going to warm up, and then this is going to be folded in thirds. Okay, now we've got it warmed up. See how nice and pliable it is. We're just going to fold it over in thirds. Takes 2 sheets of wax to make a aesthetic control base for the maxilla. Then we just place it into the buccal fold, mucobuccal fold, and just start molding the wax in and shaping it. And then we're going to cut it off, cut the tail, the back end off with the waxing knife. I'm kind of kneading this and kind of making the base a little bit thicker. And I'm shaping along. What I want to do now is pull this off. If you use a wet model, it comes off very nicely, nice and easy. And then we're going to look down and try to get the periphery of your aesthetic control base to go right where the line is that we drew on the model, or into the mucobuccal fold. See, we're a little bit short on this right now, so I'm going to put it on the model and then we're going to push it out a little bit around. Use the rim former to shape the aesthetic control base to the arch form. Flatten the buccal areas from the cuspid posterior to form the buccal corridors. Place the bar into the ECB and it is ready for a try-in. We have a rim former that we warm up, and we're going to use this for shaping the aesthetic control base. It needs to be nice and hot. You can tell when it gets hot when it starts to steam a little bit. Okay, now we're pretty hot now. Now we're just going to go around and shape the periphery, and then start shaping the arch form. The arch form just follows the mucobuccal fold all the way around. This patient has he's kind of a class 2 division 1, so his ridge in the front is relatively narrow and rounded, and you just follow the arch form, tells you exactly where his teeth were at one time. Now we can tell we're right if the wax goes down from the mucobuccal fold. It should go pretty much straight down from there. We're going to put this back on the model now and mold it into place. And this is the starting of the aesthetic control base. The Papilla Meter reading is transferred to the ECB by setting a reference mark on the model with a pinhole and transferring from this point to the predetermined measurement taken from the patient. This measurement is then transferred to the ECB. The rim former is heated up and used to melt the wax on the ECB to the mark placed there by the Papilla Meter transfer. This flat plane is the plane of occlusion and is accurate 90% of the time. The ECB is ready for try-in. This is the Papilla Meter. Our first step is to make a little hole up here in the stone as a reference point. I'll mark it with a pencil so you can see it better. But that's our reference point. And we have our compass that's going to measure down to, remember we had a 6 millimeter measurement, so we're going to measure down to 6 millimeters. It was 5.5, so we're going to go to 5.5, and that's our measurement. So now we're going to put the aesthetic control base back on the model, and then we're going to measure the lower lip line onto the aesthetic control base, and we just scribe it onto the wax like that. And then we warm up the rim former again, and we're going to melt down to that point. This rim former was designed with a lip on the back of it that fits into the annular notches, and that's the reference point to form the occlusal plane. And this sets the occlusal plane up to be about 95% of the time it's correct. And the annular notches are right here, the lowest point here in this little curve. So we place the rim former right into that lowest here, fits right onto the bar. If you're doing dentures,